Well, viewers of our show should be familiar with this next gentleman. His popular Medical Minute segments are an invaluable resource for people looking for quick, accurate answers to many of their health questions. And I recently had the chance to sit down with him. Take a look. Our next guest really does not need an introduction. He's been our resident physician on the Best Docs Network since 2010, and we're so glad to have him now as our resident physician here on Today with Kandace. It's Dr. Richard Honaker. Dr. Honaker, thanks for being with us today.
My pleasure. Thank you for having me.
So if you would, start off by talking to us just about your background.
I went to medical school in Virginia, at the University of Virginia, and I did a residency here in Dallas in family practice, and then began a practice that grew to 12 physicians.
Oh, wow.
And PAs and nurse practitioners, and I practiced in that practice for 32 years and transitioning to other practice opportunities at this time. Having had all that experience in the world of family practice, you get to know a lot of things about a lot of diseases, and that's where this whole website thing comes about as a valuable tool to help people understand medical topics and medical information.
Absolutely, and when you say website, you're speaking of your new website, AskDrHonaker.com. Tell us about the website.
Well, it's a website that has a library of the medical minutes that we do. This is a 60-second little talk about a particular subject. There's a couple of hundred, and there'll be more as the time goes on. And during that 60 seconds, I try to take each topic, whether it be diabetes, fever, hypertension, or cancer, or whatever, and distill it down to the most important points that someone needs to know. So they don't get a lot of the fluff and the stuff that's not necessary, but this is the stuff you need to know. So they can surf those medical minutes, or they can specifically ask for one topic. For example, if a mom wakes up at 3 a.m. and their kid has a sore throat and a rash, she may want to know, do I need to go to the emergency room? Can I wait till tomorrow? And what do I do tonight? Is it dangerous? And she can dial up that particular medical minute and get a good night's sleep or go to the emergency room.
Exactly. So obviously a wealth of information on the website, AskDrHonaker.com, but let's say there is a topic that someone doesn't find on there. Can they get more information on it?
Yes, we don't want it to be a stale, one-sided website where people kind of take what's there and that's all they get. If you really need information that isn't in the content already or have some particular pressing question you have, it's going to be very interactive. You can submit your question, ask for an answer, and I will respond and do that. And I welcome that. That's kind of fun, and it's impromptu, and you can get good information across in a very specific manner to someone.
Well, thanks for being with us, Dr. Honaker. And the perfect way to wrap up our interview is we're going to check out a new medical minute.
Hi, I'm Dr. Richard Honaker. There are a lot of changes going on in the world of high cholesterol. We've always thought for many years now that the best thing to do is to measure your LDL cholesterol when you're in a fasting state and try to treat your LDL cholesterol to a certain level that's appropriate for your particular diseases and age. There's a good body of knowledge now that says we may not even need to do the blood test in the fasting state. It may be just as accurate non-fasting. And you don't need to shoot for specific LDL numbers. Just if you have risk factors for heart disease based on a risk factor calculator, you need a drug like a statin, like you hear about Lipitor and Zocor and those kinds of drugs. And you're not even shooting for a specific number anymore. You're just taking a specific moderate to high dose based on these new studies of these cholesterol medicines to keep you from having heart attacks and strokes. Now, some doctors prescribe drugs based on the old way of doing things and some based on the new way. We're still trying to sort all this out, and in the meantime, it's best to just discuss this openly with your physician regarding what he or she feels is the best thing for you with your particular medical makeup.